Welcome back to Laura's Social Corner. Today, I'm so honored to be joined by Dr. Razaq. I'm saying it properly?
Yes.
Thank you so much for giving us the opportunity to talk to you, because we feel that you're making the difference in the medicine world. So
well, thank you for having me.
So Dr. Razaq, she's a board certificate oncologist and internal medicine specialist for over 25 years. So tell us a little bit more what you do.
So I am an oncologist, and I only do breast cancer. I have dedicated my life to doing only breast cancer and the research for breast cancer. It's been quite a journey. We started back from Omaha, where I was working for University of Nebraska, and I started my breast cancer treatment and research journey. From there, I came to Oklahoma University, and since then, it's ongoing. And the research has changed breast cancer world in so many ways, that even if a woman is being diagnosed with metastatic breast cancer, they live for years. So
early detection.
Yes, unlike pancreatic cancer or all the other aggressive cancers, breast cancer, because of the help of this research and medications, people are living for years.
Well, what inspired you to pursue this path in this medical field?
So when I was doing my internal medicine residency, oncology always inspired me. And also my mother was diagnosed with cancer in her early 50s. But before even she gets any treatment, there was a complication of surgery, and because of that, she passed away suddenly. So I always wanted to do oncology. I knew that from the get-go. And after doing oncology, there were different fields that you can pick: lung, melanoma, colon, breast, GI. And I just like to help women. When I was seeing these patients, first of all, the survival is so good. And, you get a lot of hugs after they are done with the treatment.
You feel good that you can save a life.
Yes. When a woman is coming with the diagnosis of breast cancer, every single woman that I have seen is scared. When they're coming to the clinic, they are scared to go through chemotherapy.
Nobody wants to even see the word cancer.
Exactly. Nobody wants to, wants to hear the word. But then when they are done with their journey and they get the news about that you're a survivor, and the cancer is gone, and we're just going to watch you carefully so the cancer won't return. That's a big news to them. I do know that these patients, when they are coming to the cancer center for the last time, they ring a bell. And it's a big ceremony. Honestly, it's a big ceremony when they're ringing the bell.
It's very encouraged for women, and that is what for me is an honor to having you here, because I have friends that have breast cancers, and when we ring the bell, it's like a life for everybody.
Yeah.
It was really emotional for everybody.
Yeah.
Because it's like you have another opportunity.
Yes.
It's like
another chance in life.
Yes, and we always have opportunities, but that one is like the first number one.
Yeah.
How the Stepson Cancer Center is the number one in Oklahoma? We can say that.
So Oklahoma University Stevenson Cancer Center is an NCI designated cancer center. And that's the only NCI designated cancer center in the state.
Yeah.
So the breast program is also it's called NAPBC accredited, which is like a national program where a viewer comes to the cancer center and review how the treatment is done for the women. And then they certify this program that, the program is doing really well. It's conducting all the treatment plans like as a standard of care. So that's the only program in Oklahoma State that has that accreditation. So, yes.
What recent advance in breast cancer treatment give you the most hope for the patients?
So, I mean, think about it. When the patients with breast cancer were diagnosed like 40, 50 years ago, at that time they did not know what to do. They were just removing the whole breast.
Scary.
And when they figured out that something is related with the hormones, they were just removing the ovaries. So it was a lot of like invasive processes that women had to go, and there was no reconstruction afterwards. From all the advances and all the research, we came to know now that not the whole breast needs to be removed. It can only be that portion of the breast, we call it lumpectomy. And if you give the radiation afterwards to that breast, the survival is the same as mastectomy. So most of the time now, this is standard of care that we like to have the lumpectomy done rather than a mastectomy. But if somebody has like genetic mutation, which again, because of the advancement, we came to know that there are certain genes that are related with the breast and ovarian cancer. So if someone has family history of breast and ovarian cancer, we can check those genes, and if those genes are present, then definitely, because the risk of having breast cancer is so high in those patients, like 50 to 70% during their lifetime, then we do recommend that they should have both the breasts removed. But at the same time, they can remove the breast, but they can place the implants behind the skin and would give you the most natural look. So, I mean, all these advancements happened like in the last, 40, 50 years.
And you've been part of the, you play a big role in medical education, right? Coordinating and rotating for medical students to lead in clinical competency committee. So what is that program about that you lead?
So that program is with the fellowship program. We have 9 fellows, and they are in that program for 3 years. And in those 3 years, they have hands-on experience on the patients. We teach them clinically. Means that, on the patient, they will have their experience about surgery, radiation, chemotherapy, all. So it's very important that we actually train our new generation to be, an oncologist after 3 years, so that they can help other people.
Right. How did you approach patient care, especially when you're working with people facing such a difficult diagnosis? How you deal with that? Because you're not a psychology.
Yeah, that's a good question. Actually, most of the time I feel very satisfied because I know the prognosis of this cancer is going to be good. The patient is going to come out of this situation, and they will be living their normal life.
Positive.
Yes,
wonderful.
Most of the time that's what happens. But there are some types of cancers that are very aggressive, like triple negative breast cancers, HER2 positive breast cancers. They're pretty aggressive cancers, and when a patient is not responding to the treatment, that's when the problem comes. So patients who are very young, like, in their 30s or even in their 20s, when I lose them, that becomes very difficult to deal with.
Right. But the good thing now, chance to lose a patient with breast cancer is very low.
It's not as much as it used to be.
Yeah.
But as I said, there are some aggressive cancers that we are still, looking into how to deal with them.
Right. Maybe something, when the woman's had implants, what do you recommend to get the best mammogram? Where should it be the best mammogram for them?
Oh, that's a very good question. 3D mammogram is a really, really good mammogram. They take several pictures of the breast and really give like a 3D, three-dimensional picture to the radiologist.
Okay.
And radiologists will be able to see even the smallest thing in it.
Oh, wow.
And if needed, they can do an MRI of the breast too.
Right, because this is that is what you recommended with the have implants, a 3D mammogram, because we're trying to inform the women there.
Right, right.
Because we have a lot of ladies that we know they have implants and they go to regular mammogram.
Yeah.
I just have heard that last week, and I said, oh, that's a good question for Dr. Razaq.
Yeah, 3D mammogram, wherever you're going, ask for 3D mammogram. It is covered by the insurances. You know, it really is very, like, you know, give a really good picture to the radiologist to look at.
Thank you. That's a good information. What do you hope to achieve or continue building through your work at OU Health?
So, you know, one of the researches that I am really excited about is how to find out in a patient when the recurrence is going to happen. And if the recurrence is going to happen, can we differentiate between those people? Like, you know, like if we treat like 10 people, we know from the stage of the cancer that if it is stage 3, the chances are high. If it is stage 0, the chances are low. But out of all those stage 3 people also, there are some people who recur pretty quickly, and some people, they don't recur or recur very late. So there are some research going on, and through a blood test, we should be able to find out that if those cancer cells are in your body. In the body, yeah.
Oh, wow. So who will give you the blood test? We can go to a regular doctor?
No, it's a special test.
It's a special test.
Yes, it's a special
test. So that we
test.
need to see is in our blood.
Yes.
Before.
Yes,
so
but that is still under research.
Okay.
That is not something that, you know, is FDA approved yet.
Okay.
But I think with the research, with more, you know, looking into it, I think pretty soon it is going to be FDA approved.
Thank goodness, and thank God for doctors like you. They're very dedicated to those research, because it's dedication.
Yeah.
So you are also served on the Breast Administrative Committee. You serve at the Breast Administrative Committee?
Yes. So that committee is looking at all the research, the clinical stuff, how the treatment plans are going, and are they going to be, you know, based on the standard of care. So I oversee all that at Oklahoma University. We have a tumor board also that I run, and in that tumor board, what we do that we have a surgeon, we have you know, medical oncologists, radiation people, radiology people who read the mammogram. All of them, all of us, we actually sit together and discuss the patients who were recently diagnosed. So it's like multiple eyes are on the patient, which I think is like superb, because, you know, if you have multiple minds working on one thing, I mean, good things happen.
And also when there's many doctors seeing the patient different days a new symptom, different days new information they can bring at the table.
Right.
So it's like a big investigation and research. Only this happening right now in OU.
Yes, right now all the research and everything is happening at OU.
Wow, that's wonderful.
Yeah.
What has been the most rewarding part of your journey so far?
When the patients, they come back and they give me hugs. I go, you know, if I, like, most of the time I am, like, you know, in a grocery store, and they're like, oh, that's my doctor. And, you know, they come and give me hugs that, thank you for saving my life. Their family members, you know, they come. It's very satisfying.
I just can't imagine, because it's, I hope I've never been in those shoes, but when you say the patients come and tell you, you saved my life, you don't only save their life, you save the people to not be in pain. It's a completely family that is not in pain because they lose somebody they love.
Right.
So it means a lot.
Yes.
Right?
And, you know, a woman is surrounded by a lot of people, the kids, the husband, the siblings, mom, dad. So it's not just about one woman.
Right.
It's about a family.
Yeah, a community.
Yes.
It takes a lot.
Yes.
So women, we are very friendly. We open the house, and it's like I cannot imagine without my mom or my sister. It's just difficult.
Yeah.
Can be difficult for all the family. So those people that are around the person that is with cancer or facing that, they have a special treatment. What you recommended for the family?
So the family, they need to talk to their primary care doctors about what kind of cancer is in the family, if there is any. Breast, ovarian, that runs in the family. The special genetic mutations that are related with the are BRCA1 and BRCA2. That's the most common ones. There are other ones too, like ATM, CHEK2, PELB2 mutations. They run in the family. So if somebody is diagnosed with any of these genetic mutations, they need to tell their doctors so that the screening can happen early. Make sure that you're self-examining, and if you notice any problem in your breast, like skin is red, any swelling, any nipple changes or discharge, or any lump that you feel, all of that needs to be reported.
Oh, wow. That's a lot of good information, ladies. Please pay attention, because, we are in the month, the breast cancer month. So tell us a little more about the OU, the mobile facility.
Yes. So OU has started back in 1980s a mobile mammography, and they actually go to all the rural areas of Oklahoma State, where so that they can bring the care to their doorsteps. There are many people who live out in the country, and they don't have any medical facilities close by, so they have to travel like 2-3 hours to get to the mammograms or any other stuff. So for those women, this mobile unit actually goes around the Oklahoma State, and they do the mammogram right there.
That's a really wonderful news. And how they can contact on the website? Or?
Yes, so go to ouhealth.com website, go on the breast cancer page, and you will find all the resources about the mammography in the city where they offer, and about the mobile unit, when it is coming, and what is the schedule for that month.
So what Dr. Razaq do when it's not working? What do you do when you're not working?
So we have 3 kids. I love to spend time with my kids, because I feel like that, most of the time I'm at the, at the hospital working. So I love to spend time with them, watch their games, and, other than that, I love watching movies, just relaxing at home, traveling. So these are a few things.
This is a few things that you like a hobbies, huh?
Yeah.
So Dr. Razaq, thank you so much for sharing your story with us, for your wisdom and open your heart. And I hope this interview gets inspired to other women.
Yes. So I want to say to all women that American Cancer Society recommends all women above 40 years of age should get annual mammograms. It does not matter if you have insurance or not. Anyone can get mammogram. If you can go at ouhealth.com, and you can find a breast cancer page over there. You can find all the resources. State program has early breast and cervical cancer detection program. Through that program, you can get low cost mammograms, as well as it can be free too. So you just have to contact them. If you feel something in your breast, you can come to OU Health, and we should be able to help you getting a mammogram and starting this journey. We like to help people and encourage everybody to get, if there is something going on, get help. at an early age, an early stage. Mammogram is very, very important in that journey. And it should be able to see everything in the breast. And if needed, we can do the MRI of the breasts also to find out more about it. But do not ignore anything what's happening in the breast.
Thank you so much. For everybody watching, please don't forget to follow Laura's Social Corner for more patients. It's really my honor. Thank you so much for having this interview.
Yes, thank you.
And I hope this works for many, many women out there. So see you next time.